Hello everyone, this is Dr. Manohar, consultant physician and diabetologist from Manipal Hospital, Bangalore. I am also the scientific chairman for Karnataka State Chapter of RSSDI. I am very glad to be a part of this medical extravaganza happening in Chennai, the golden jubilee year of 50 years of RSSDI. Topic which was given to me to discuss was lifestyle interventions in obesity, how effective. I was lucky to have a good speakers who spoke about various other parameters on obesity, including lifestyle intervention. But how effective we are is the question what I need to answer. We all talk about this, isn't it? Genetics load the gun, but it is our lifestyle which pulls the trigger. It's very, very apt. We also joke on this. Obesity may not run in the family, but none of the family members run or may do healthy activities. So that could be one of the causes. But fine, lifestyle changes include diet, modifications, exercise, and most importantly what we may forget in our practice is behavioral changes. Soon technology is coming into this aspect also, and it will integrate all these things. But when I looked at all the trials and their meta-analysis, what did I find? Individually each is not effective. Especially if you add behavioral changes, the effectiveness of each parameters gets improved. Secondly, it is individualized treatment. No one size fits all, we all know that. So it is individualized, each person is different, so tailor according to his needs. And when we do all these things together, definitely most of the trial, the meta-analysis says that anywhere between 1 to 11 kgs is the weight loss. But sustainability is the key. So what happens when someone doesn't follow it and leaves it at that juncture? Means you follow diet, exercise, you lost some amount of weight and you don't do anything about it. 30% of the people will gain back some amount of weight within 1 year, and within 3 to 5 years they get their complete weight back, which is a bad news. So what does it say to us? How do we have to place our practice? First important aspect is take consent from the patient, very, very important. Individualize the treatment. Each patient, each person is different, socio-economically, in his acceptance, in the behavioral aspects. Third, individualize the goals. Don't get high about looking at the media's messages on some motivational videos on some people lost 20, 30, 40 kgs. It may happen, it would have happened, but not in all cases. So individualize, set realistic target. That's the most important thing. Set realistic targets for your patients. Then diet is more important than exercise if you want to differentiate that way. But when they work together, especially when you do behavioral modifications, it is much more effective. Friends, an ounce of prevention is better than tons of treatment. So I always, wherever I speak, I emphasize the fact that ideal weight, monitoring your BP, sugar, knowing the normal values should become a school curriculum. And also in the companies with which I am associated, I tell the HR people, please give health targets at least. Very important message. Thanks a lot for the patient listening. If you want to see the whole talk, it would be available online and I will give you the link. Thank you.